Hello, thank you for joining us today. My name is Shannon Welch. As a woman with disability, I am proud to represent People with Disability Australia. Today, we will be discussing the importance of the Australian Digital Health Agency's My Health Record that can significantly enhance the healthcare experience for people with disability. My Health Record is a secure online summary of an individual's key health information. It allows healthcare providers to access and share vital health data, ensuring that people with disability receive the best possible care tailored to their unique needs. During this webinar, we will explore how My Health Record works, its benefits, and how you can make the most out of this digital health tool. We also have representatives here from the Australian Digital Health Agency to address any concerns and answer your questions to ensure you feel confident using your My Health Record. But before we begin, I will just cover the webinar housekeeping. For privacy, you will notice as you join today's webinar, your camera and microphone are by default. Today, only the cameras of the presenters will be turned on. The webinar is being recorded and will be published on the PWDA website. Accessibility functions. So to access captions, please select the closed captions button. We do have Auslan interpreters here today who will be spotlighted and should now be visible on the screen with today's speakers. Interacting in the webinar. Today, you will have various opportunities to share your thoughts and join in the conversation. This can be by text in the chat function, submitting a question in the Q&A, and by using the poll function during the myth-busting section. PWDA staff members will keep in a close eye on the chat, and your questions and comments will be noted. We will then answer questions at the end of the presentation in our Q&A section. When we launch the Zoom polls during the discussion, the polls will come up on your screen and you will then have a few minutes to respond to the poll. You can also add answers to the poll in the chat and our PWDA staff members will share these with the presenters. How to send messages with chat. Click the chat button to open the chat panel. Type your message in the text box at the bottom of the panel. You can select to send messages to everyone or just to the hosts and presenters. Press enter to send your message. You can also ask questions and provide comments through the Q&A function. To do this, click the Q&A button to open the window, type your question in the text field. If you want your question to be anonymous, check Send Anonymously checkbox, then click Send. We will do our best to answer all questions. If we are unable to answer everyone's questions, we will follow up with an email directly after this presentation. And then finally, to cover technical support, if you have any issues participating in the discussion, you can let the username PWDA technical support know in the chat box or call or text 0490 839 986. I will repeat that again. So that's 0490 839 986. The PWDA team member is here to help. You may also hear or see messages from our PWDA team members from time to time to support our speakers and discussions in the chat or Q&A. So let's begin. I'm going to start today's webinar with an acknowledgement of country. We acknowledge the traditional owners of the lands on which we meet today and pay our respects to elders past and present. We extend that respect to Aboriginal and Torres Strait Islander people here today. Always was, always will be Aboriginal land. So here is a brief overview of today's agenda. Firstly, we will start by explaining what the Australian Digital Health Agency is all about. Next, we will dive into digital health services with a special focus on the My Health Record and the My Health app. We will then move on to a myth-busting activity where our Australian Digital Health Agency representative will be clearing up some common misconceptions. And then finally, you will have the chance to ask questions in the final Q&A session at the end. So let's start with exactly what the Australian Digital Health Agency is. The Australian Digital Health Agency is a government organisation that enables all Australians to access their health information online. Key services include the My Health Record, which provides a summary of your health information, and the My Health app, allowing you to access your My Health Record on your phone or tablet. Additionally, electronic prescriptions offer to digital prescriptions for your medications. While we won't cover electronic prescriptions today, we do have links to information on electronic prescriptions and how you can use them on our PWDA website. These links will be shared with you after this webinar. These services ensure that people can securely search and update their health information online. PWDA has been working with the agency to make it more accessible for people with disability. So, what is My Health Record? My Health Record provides an online record of a person's health information, including medical history, doctor's appointments, current medications, test results, and more. It is controlled by the person, which is a key element of the system. What this means is that an individual has a say as to whether they have a My Health Record, what gets uploaded, what stays in your record, and who can see your record. My Health Record is part of a national system, meaning it travels with the individual wherever they go. For example, if you have a GP in Western Australia and you visit a GP in Queensland, they can access your My Health Record. Your My Health Record is always available to you and your healthcare providers involved in your care. The record can be viewed and updated, subject to access controls set by you. And finally, My Health Record is protected and safe. Importantly, your record is protected by legislation, primarily the My Health Record Act. My Health Record is secure through multiple layers of international best practice in IT security. For example, we have a cybersecurity centre which monitors, maintains, and improves the system 24/7. These include strong encryption, firewalls, secure login processes, and audit login. All data within the My Health Record system is stored securely in Australia. A very common question is, do I have a My Health Record? Starting in February 2019, everyone in Australia who had a Medicare card got given a My Health Record account, unless they chose not to join. If you have just arrived in Australia, you might have chosen to have a My Health Record made. If you are a person who does not have a Medicare card or Department of Veterans Affairs benefits, you may still be able to register for a My Health Record. If you're not sure if you have a My Health Record, we will provide a link to register in the chat. And as mentioned in the introduction, you'll be provided with all the relevant links again after this webinar. Let's have a look at what is in My Health Record. The information comes from a few different sources. Firstly, your healthcare providers may upload clinical documents which contain information about your health and care. Some of these types of documents include shared health summaries, hospital discharge summaries, medical event summaries, specialist letters, pathology or diagnostic image test results, immunisation information, or Medicare information. It is crucial that your healthcare professional proactively uploads the information onto your record. Therefore, you will need to inform your doctor that you want your information uploaded. You can choose what information flows into your record from a range of sources. By selecting the Settings tab in your Records profile, you will be able to see what you have set up already. Using the web version of My Health Record, you can also add information about your health. Or if you are a representative, you may be able to add information to the record of the person you care for. This can include your own summary of your health. Think of adding information about medication you use or allergies that you have. Notes that you have about your health that your healthcare providers cannot currently see. Your advanced care planning documents and custodian details, or your emergency contacts, or even your childhood development details. Let's look at some of the ways My Health Record benefits you. My Health Record allows you, your representatives, who may be your carers, and your healthcare providers to access your health information. This includes any information about medications, allergies, and medical history that's in your record. This can improve coordination of care between different healthcare providers and reduce the risk of medication errors. My Health Record can help you keep track of your test and scan results. When your healthcare providers can view these results, it reduces the need for repeat tests and procedures. My Health Record also improves coordination of care, which means that if you have multiple healthcare providers, they can view details of your health and care that have been uploaded by others. This may increase the quality of the care that you receive. As mentioned on the previous slide, you can also add information to your record, your allergies and adverse reactions, medical information, advanced care planning documents, and emergency contacts. This may be critical health information to your healthcare providers, especially in the case of an emergency. When you can view and add information in My Health Record, you can keep track of your health and any medical condition that you may have. I will now introduce you to Cohen, who is a representative of the Australian Digital Health Agency. He will be running a series of polls that will pop up on your screen, and you will have a few moments to answer them. As mentioned earlier, you can also add your answers to the polls in the chat, and PWDA staff members will share these with us. Cohen, over to you.
Hello, everyone. My name is Koen. I am from the I'm representing the Australian Digital Health Agency here today. I'm very honored to be here with all of you. And we're going to do some myth busting. So the idea is, and I think Shannon already introduced it, but I'll just give it my swing as well, so it all makes sense. We're going to state some myths on the screen here, and you will get a little pop-up for a poll that says, well, gives you 3 answers to give. It's going to be practically like, do you think this is true or yes? Do you think it's untrue or no? Or you're unsure whether this is true or not true. There's no right or wrong answers. It's really just for us to get a bit of it's a way to engage and interact with My Health Record. If you have any trouble with the little pop-up boxes in Zoom in the poll, please put your answers in the chat. We will be monitoring that as well. Okay, let's see. So if we can go to the first myth. Next slide, please. Thank you. All right, the first one, here we go. Everyone can now access My Health data. Now I have a My Health record. Good, that was quick. Okay. It's okay if you are not sure about it. As I said, there's no right or wrong answers. It's just a little way to have a bit of fun with this information. Yeah. All right. I think that's us. I got, it's an interesting spread we got here. I think you can all see it. So we have 30% says yes, 60% says no, 10% says it's unsure. The actual answer is indeed, it's a no. So not everyone can now access your health data. Now we have my health record. There are a lot of security mitigations and rules in place to keep your data safe. And besides that, there is a way to tailor the access from your end a lot. And we'll talk a bit more about that later. Okay, thank you. Are you ready for another one? I hope so. It's very strange for me to do this without any actual feedback, so I assume you are. Here we go. I need to have a Medicare number to get a My Health record. Is that true or untrue, or you're unsure? Okay. Okay, we have about the same amount of people answered as last time. I'm going to give you the answers now. So 67% says yes, you need a Medicare card to, or a Medicare number to get a My Health record. 70% says no, 70% is unsure. Now, the correct answer is it's very handy to have a Medicare number available, but you do not need it per se. Other ways to get or to register and get access to your My Health record would be via a DVA number or an individual health identifier number. And this number you can actually request via a link, which we'll share later. And there's even a way to do it by paper form if needed. So don't stress if you don't have a Medicare number. There are other ways as well. Okay, and I think that brings us to this part of the myth busting. I will hand over back to you, Shannon, if that's okay. Thank you all for your answers. That was good.
Thank you, Colin. Apologies for the technical problems there. I hope everyone is back on and can see everything. So now we'll be discussing exactly what a nominated representative is. This is where you can pick an individual you trust to view and manage the information in your My Health record. These people are known as nominated representatives, such as children who have just turned 14, older Australians who require assistance, individuals with a disability, individuals who speak English as a second language. You can choose trusted individuals to access and manage the information in your My Health record. These individuals are called your nominated representatives, and there is no limit to the number you can have. You might choose a family member, friend, or carer. You can also decide what information you want them to see and can change your mind at any time, removing their access if needed. To let someone be your representative, you'll need to invite them to gain access to your record. There are easy read documents on how to do this on our PWDA website. Authorised representatives are slightly different to nominated representatives. Authorised representatives are individuals who take care of a My Health record for a person who is unable to manage it themselves. This could be a parent, a caregiver, a family member, a legal guardian, or someone who has legal authority to make decisions for that person. They can fully access and manage the health record just like it's their own. This means that they can view, remove, and add information, choose whether Medicare information is added to this record, choose which healthcare provider organisations can access this record, restrict access to specific documents within the record or to the entire record. They can also add or remove nominated representatives, view other authorised representatives, or they can cancel the record to delete it. An authorised representative must make reasonable efforts to identify and support the will and preferences of the person that they represent. If the will and preferences of the person cannot be identified, an authorised representative must act to promote the person's personal and social well-being. It is also good to know that the person can have one or more authorised representatives. We will now watch a brief video on the value of having a My Health record.
West Australia's a pretty interesting place, 2.5 million square kilometres, about 2.5 million people, or just over now. On average, that means one person per square kilometre. And that means that some people who we care for are a hell of a long way away. And when you've got a big place, often it's hard to ensure that people are connected and that information is well shared. And without doubt, at the moment, the best place that we can have access to is the Australian My Health record. So information collected in one location becomes information available in another location. And that now doesn't matter whether that's 2,500 kilometres or 2.5 kilometres. And the fact that it's becoming universally available is valuable. The fact that Western Australia now accesses the My Health record 10,000 times a day says one thing that's really important. Health professionals are beginning to deeply value this as an important information source where I should spend some time because it helps me deliver care safely and effectively.
So, how My Health record keeps your information secure? As discussed throughout the webinar, the My Health record system has numerous safeguards to protect your information, including strong encryption, firewalls, secure login processes, and audit login. The security of your information is maintained through a combination of people, processes, technologies, and legislation. Firstly, your settings. You have control over the privacy settings within the system, determining who can access your information. People. The Cybersecurity Centre within the Australian Digital Health Agency monitors the My Health record system. All personnel involved undergo security checks. Technology. The system uses a layered security model with multiple controls to protect the confidentiality, integrity, and privacy of your healthcare information. All data is stored securely in Australia. Processes. Various security processes limit access to the system. External software, including healthcare provider software and mobile applications, is tested for safety and security before being allowed to connect. And finally, legislation. Your rights and the My Health record system are protected by law. The primary purpose of your My Health record is to support your healthcare. No one can access or ask you to disclose information from your My Health record for insurance or employment purposes. Information cannot be released to law enforcement or government agencies without your consent or a court order. Your healthcare data cannot be sold or used for commercial purposes. It is a criminal offence for someone to misuse your health information. So, My Health record privacy controls. You can control who accesses your My Health record by adjusting privacy settings. You can choose which healthcare organisations can see your record. One of the ways you can restrict access is by a limited document access code. This is where you can create a code to restrict access to specific documents. You can then share this code with the healthcare providers that you trust. Another way is by using a record access code. This is a set code to limit access to your entire record. Then only those with codes can view your record. In emergencies, healthcare providers can use a break glass function to access your record, but these instances are monitored and logged. Another privacy control feature is the SMS or email alerts feature, which alerts you when a new healthcare provider accesses your records or uploads any documents. Remember, healthcare providers are not legally required to use the My Health Record system. They will use it based on their clinical judgment. So, how do you look at your My Health Record? Well, there are two main ways to access your My Health Record. The first is through logging into MyGov on your laptop or phone with an internet connection. MyGov is a government website where information about you is kept. If you don't have a MyGov account, you can create one. When you sign into MyGov, you can click Link a Service, then click My Health Record. You can then view and add information to your My Health Record here. The My Health app. So what is the My Health app? The second is through this system where you can view information from your My Health Record. The app is made to be used on your phone or tablet device. It has good usability, and you can even use the accessibility settings that you have set up in the operating system of your device. The My Health app also lets you download documents from your My Health Record onto your phone, giving you the opportunity to share these documents with other people or organisations. We will now watch another brief video on the My Health app and what is in the My Health app.
When you need access to My Health Record information, it can be securely viewed using My Health app on your mobile device. When you first log into My Health, you will see the home screen. From this screen, you can access health information and documents added to My Health Record by you, your healthcare providers, and your representatives. Selecting the Medical History tile will take you to your medical history timeline. At the top of the list, you will see your most recent health information. You can swipe up and down to see more of your health information, or choose an option from the filtering menu at the top of the page to find specific information like immunisations. Select Home to return to the home screen. The next section displays a list of tiles which gives you access to information about medicines, allergies and reactions, immunisations, scans, and a range of other test results and health information. At the bottom of the screen, you will see 3 menu options, including Home, Help, and Account. If you need help with using the app, select the Help option. This will give you access to a list of frequently asked questions, an option to rate the app, and helpline information. The Account icon in the bottom menu lets you view your account information, switch to another person's record you have linked to My Health, change your account settings, learn more about the app and its policies, and log out of My Health. Select the Home icon to return to the My Health home screen.
If you would like to download the My Health app, we will provide a link in the app. You will also be provided with a slide package at the end of the webinar, which will have the links available. You will see on the screen there are 2 QR codes that you're welcome to use now. There is more information on both the PWDA website and the Australian Digital Health website. On the PWDA website, you can find information about future webinar sessions, links to the Australian Digital Health Agency website, and easy read documents on the My Health Record, My Health app, and electronic prescriptions. On the Australian Digital Health website, you can find digital health learning modules on the My Health Record, My Health app, and electronic prescriptions. There are also links to further recorded webinar sessions on a range of topics, which are all Auslan interpreted. I will again be handing back over to Karan for our second myth-busting activity. Again, a series of polls will appear on your screen.
Hello, can you hear me? Okay,
Yes.
so here we go. The next one is, can we display the next myth, please? Thank you. So, I only have a smartphone. I don't think I can register for a My Health Record and use it without a PC. What do we think about that, everyone? Is that a yes, a no, or an unsure, in your opinion? Okay. I think we got the answers we're looking for. So 4% says yes, that is a bit tricky. I don't think I can really use it very well if I only have a smartphone. About 86% of you has said, nope, that's not true. And 11% is unsure. Well, the answer is no. You actually can do a lot with your smartphone. And to get a bit more into detail there, you can set up your My Health Record with many different devices, as long as they have a web browser and an internet connection, that is. If needed, you can also set up your record using a paper form, as I mentioned already before. But after that, you will need to use a digital device to access it, obviously. Once you set up, you could use a mobile app as well, the My Health app. And just to clarify, the My Health app is particularly useful if you want to view your My Health record. If you want to edit or change anything in it, the web browsed version is a better place to be. And you can actually, on the app, however, what's really great about that is that you can actually change the color scheme from light to dark. So there's a bit of accessibility perks there. And it will also take into account any accessibility settings from your phones or other mobile device operating system if you set up so. So for example, if you'd like to have a larger font size to increase legibility, that will come also appear in the app. Okay. Next myth, please. Okay, this is always a big one. My medical information is now stored on server farms all over the world. What are your thoughts on that? %4 says it's yes so far. 8%, okay, good. We're still ticking. Again, there's no right or wrong answer, so don't hold back of answering if you're unsure. That's absolutely fine if it's not what you expected. That's why we're doing this, right? We're debunking the myths here, so yeah. All right, I'm gonna go ahead. So my medical information is now stored on server farms all over the world. 11% says yes, that's the case. It will be all spread out all over the world with all the implications and troubles that come with that. 82% says nope, that's not true, and 7% is unsure. The good news is it's all stored within Australia. That's just to keep things a bit clearer and safer for all of us, and much easier to control. And as I said, and I hope it also has become clear, there are many, many safety barriers put in place to keep your data safe. All right, and that brings us to the end of this myth-busting round. And it's time to go into the Q&A. And Shannon, back to you, but we'll be doing this together, right?
Yes, so thank you. So you will now have the opportunity to ask Cohen any questions that you may have using our Q&A function. So to do this, please click the Q&A button to open a Q&A window. Please click here and then type your question in the text field. Please note, if you want your question to be anonymous, please check the anonymously checkbox and then click send. You may also choose to use the chat function to ask your questions there, and our team will monitor this for you. So we'll give everyone a few moments and then we will start going through some of them. Again, as mentioned, if we are unable to answer your question live today, we will certainly be chasing this up with an email after the presentation. Okay, the first question is, what is a server farm?
Thank you there. Good question. This was a very good question, actually, and I did not realize that it might need a bit of explanation, but yes, good point. And please correct me on these things while we go, right? If there's anything you feel like that was too technical, too jargon, yeah, please ask us to give a easier interpretation. So this one, what is a server farm? A server farm is practically it's not really a farm. It's a place where it's a place with lots of buildings where a lot of servers, and servers are the machines that store a lot of data that's online, is stored. So you could see it as an enormous memory bank, or like a hard disk. Maybe that's a metaphor that makes it a bit easier. A giant hard disk, but then really, really large, and they are present all over the world. And a lot of the online data that is available comes from a data from one of these farms. However, as I said, we only use server farms in Australia for the data on my health record. I hope that clarifies the question a little bit.
Okay, thank you. Next question. What about privacy concerns? As a disabled woman, I have old medical records written by my misogynist male doctors, which led to subsequent terrible care from other doctors who read those reports. Is it possible to have inappropriate documents removed from my health record? And if so, how hard is it to achieve this?
Okay, thank you. Yes. So I think it's a very good question. And there is a way to actually request removal of documents in your My Health record. So again, you are in control of what is displayed there and what is viewed. And if you feel things are incorrect or not to what you want it to be, for whatever the reason is, and this can be because they're incorrect or there's certain data that you may just not want to be out there, then you can actually request removal. I might put the link to that later on. Maybe someone else can I'll take note of this and make sure you get that through. I will share a link how to do that on our website and gives you more information. Thank you. That's that question. Let me see what else is there.
Again, we will
There's
share lots of links as well after today.
yeah, yeah. Yeah, I got another one here.
Okay, so we've got another question. Can I authorize my pharmacist to access my records, especially around allergies and medications?
So the first question to ask is ask your pharmacist if they have access to my health record and whether they are registered, because medical health professionals, including pharmacists, are able to register their practice and have access to everything that's online available in terms of my health record. So if they have that access, they will be able to pull up your data if you allow them to of course. Yeah, and in that way, in your My Health record, there should be your allergies and medications recorded. Actually, allergies are usually something that you add yourself. Medications will be stored automatically based on other data from other pharmacies that you've been to. Okay, next question, please.
Great. These are all really great questions.
Yes.
So we have another one here. Is an authorized representative useful if I'm caring for someone with increasing dementia? Who do I approach about this?
Okay. Yes. Okay. Authorized representatives. Yes. So this is always a good question. It's a big topic. We will share a link how to register, but considering the context that you give here, so caring for someone with increasing dementia, we would recommend that as a very good idea. If you are the primary carer particularly, that is good. So we will share a link about that later on, but it will mean that you become completely responsible for this person's My Health record. I hope that clarifies it a bit, but the answer is yes, it's a good idea, and we will share the link. Okay, do we have time for another question? Can I just ask? I think we.
Yes.
Here's a good one.
Yeah.
I got one other one here.
Great.
See, there we go.
So we have one here. Can allied health professionals also use it? Physio or optometrists as an example.
Yes, they can. So this is a very, it's an area where we are currently doing a lot of work in to get them more access, get all allied health professionals better access and more involved in the process. But yes, it is definitely possible for them also to access your My Health record. And situations that become very interesting then is that your how should I say, your health journey. So I can actually speak from my own experience here. I'm diabetic, so I see doctors, but I sometimes also see dietitians, like allied health professionals, etc., for my health. And when my dietitian is actually able to see what my doctor has reported and wrote, suddenly things become a lot easier. So yes, they can access it, and it will make life a lot easier if they do that. Now, there's a little thing I'd like to add to this regarding whether for example, the GP, if you encounter a GP that says, you ask your GP to upload your data into My Health record, and the GP says, well, sorry, I don't want to do it. Legally, they are allowed to do that. So what we recommend, and this is something maybe we should pick up later, but it's still not mandatory for medical health professionals to actually upload all your data. You can always request it. I think the main advice there would be, if they don't do it, even though a lot of medical health professionals are registered and are able to do it, the advice would be to look for someone else if that's what happens to you. I hope that's some helpful extra information here. All right. let me see. As you can see, I'm handpicking. We will make sure that everybody gets their question answered afterwards via the email that we sent you the recording and the webinar deck with as well afterwards. I'm just trying to find some other questions that are maybe interesting for everyone.
We have a question here.
Yeah.
Can I upload documents? Is there storage? If so, is it stored forever?
So if that's okay, there is a part where you can put health notes, but that's not really a storage area for files. So I would like to answer that question actually offline and give you a proper answer there, if that's okay. And I can give you a bit more insights there. I think for now, yeah, let me see. Actually, this is maybe an interesting one. And I'll make that the last one of today.
Can I have more than one authorized representative?
Yeah, so yes, that is possible. So in when someone needs a lot of care and there's multiple carers involved, who can have the final say in many matters, that can be very, very handy. And yes, you can do that. It's a bit of a nitty-gritty detailed one, but it might be applicable to some of the people here today. I think it's very useful to know that yes, you can arrange that.
Amazing.
All right.
Great.
I think that brings us to the end of it for today. As I said, we will send answers to the questions afterwards and share them via the email.
Yes,
over to you, Shannon.
absolutely. We have noted that there are lots of questions in the chat as well as the Q&A section. So we will get back to you on all of these questions. We will ensure everyone has the correct links and the information that was in today's presentation. So thank you for answering all of those questions, Corinne. I really appreciate that. So as we come to the end of today's session, we would really love if you could take a few moments to complete our feedback survey. This is a great way for us to understand what we're doing well and areas we can improve on our next webinar. On the screen, there is a QR code which you can scan using your mobile device, or alternatively, a link has already been provided in the chat for you. I will leave this on the screen for a few moments. And just to note again, we will be having a second webinar. We will be covering off some of the more detailed areas of privacy and concern, but we will get as much of that information to you today as well. I'd also take this opportunity as well, if anyone has any further questions, please still feel free to add to the chat. Okay, so thank you for your time today. You will all receive an email with the links and information from today's session, and we look forward to seeing you in our next webinar. Thank you.